970 WMAY, the news and talk of Springfield. Good morning to you. The program brought to you each and every weekday morning by Williamsville State Bank and Trust. Watching mortgage rates? Just go to WSBT.net and sign up for Rate Alert today. And by St. John's Hospital, transforming healthcare. As we were discussing this morning, more signs that we are headed towards a real crisis, calamity, catastrophe. Whatever word you want to use, it could get very, very ugly. And the effects on people, the most vulnerable people in our state, can no longer be ignored with the looming budget crisis. Yesterday, a group of social service providers here in Springfield held a news conference to talk about what exactly this means. And this is not just in the abstract. These are actual cuts that they have been told by the state that they will have to implement because the funding just simply isn't there. The Illinois General Assembly approved a budget last month that did not fund social service programs in the level that had been anticipated. In fact, it's only about a 50% funding that at this point would have to last the entire 12 months with no guarantees that any additional money would be coming in. The Quinn administration says it has to deal with that. That budget not actually formally sent to the governor yet, and it's not been signed. But because the money's not been appropriated, they're telling these agencies, service agencies around the state, that you simply have to start making dramatic, very painful cuts. Now, one of the most alarming stories we've heard yet came from the Hope Institute at this news conference yesterday. And the executive director of the Hope Institute, Dr. Joe Nyre, is here with us this morning to talk more about that. Joe, good morning to you. Thanks so much for being here.
Jim, thank you. Good morning.
Well, you did talk about what, at least from what I've heard so far, is perhaps the most disturbing scenario yet that could play out if indeed this situation does not change. And you mentioned 41 clients specifically who are in residential care here in Springfield whose lives are about to be turned upside down in the most gut-wrenching way. Can you give us a little bit more background as to who are these individuals, what's their current status, and what is to become of them if this situation is not altered?
Certainly. We were very surprised by this level of cut as well. Our main campus, we serve children throughout the state of Illinois, but our main campus has children who have developmental disabilities with severe life-threatening health conditions and behavioral conditions. They reside on the campus because they require and utilize 24-hour health care and behavioral health care services to ensure that they are safe and that their life continues. They're here because no other agency in Illinois has been able to serve them. We received notice on Friday that as of October 1st, we will send these children home, not to another provider, not to a hospital, but home to places where they won't receive 24-hour health and behavioral care that they, without question, need. We received that notice on Friday. We received letters for the families on Wednesday, and we were told to contact them immediately. So we began calling parents on Sunday and Monday to share with them the directive from the Department of Human Services. We also attended the governor's press conference in Chicago, where he said that those letters are a directive from the governor, not proposed cuts. And some people may think October 1st is some time away. That's a long time. You should be able to get the budget fixed before then. Unfortunately, the amount of preparation that is required to move a child with these severe needs is significant. So we'll begin the process of moving them home in the very near future because we've been directed to do so.
What are these families saying to you in reaction as you're contacting them to tell them that the care their children are receiving will not be there in the very near future and that they are now going to have to take on this extreme responsibility with virtually no help?
The best response, I've heard many responses. Most parents are brought to tears and then the anger, as you might imagine, but great concern that their child may not survive. And one mother asked me, are you telling me that our tax dollars, state and federal, can go to support car companies and banks, but a child or the elderly with a life-threatening health condition will have services discontinued because of the state budget. And I was left to say yes to her. And I think that question and her response really does maybe sum up the situation.
I don't want to engage in hyperbole here. I don't want to make things out of proportion. But as you describe the situation, it sounds to me like the state of Illinois, the Quinn administration, has in effect just passed a death sentence on at least some of these 41 individuals. If there's no other help for them, if they're going back to places that are simply not equipped to provide the round-the-clock care that they need, as you said, some of them may not survive. Am I exaggerating in describing it in that way?
You're not exaggerating. The Quinn administration has been clear. 300,000 people across Illinois will have services discontinued. Of that 300,000, the stories of the 41 children at Hope, the elderly that have life-threatening health care needs, and even people that are residing in state hospitals due to mental illness that are, without question, will hurt themselves or others, those services are being cut. And I know that some people, as they listen to all of this, start to think, well, it's going to get fixed. But we have to begin discharging these people. There are 300,000 people in Illinois that are going to have their services discontinued. Of that 300,000, many of them have life-threatening conditions.
I put this question to you yesterday at the news conference. I want to put it to you again this morning because what we're hearing from the Republican leadership in the General Assembly is that it does not have to be this way. The General Assembly passed a budget, albeit a budget at roughly 50% of requested levels of human services funding, and that would at this point have to last for the entire 12 months. But even so, couldn't the Quinn administration enact that budget, at least keep these programs going for as long as they can? Ultimately, you may be back in this boat 6 months down the road, but wouldn't that ultimately be more moral and more humane to continue these services for as long as possible rather than pull the plug now when you could sign that budget and still have this funding for at least a while longer?
I can't disagree with you, Jim. I don't like paying more taxes. I know most people don't wake up in the morning thinking, let's pay more taxes. We're all taxpayers. But we also recognize that our society and our country, the best country in the world, takes care of people. And it costs money to take care. It takes money to take care of people. And to stop taking care of people or to make that threat as a political maneuver for a tax increase, I think is unconscionable.
So where should our anger be directed? To whom should we, the people of Springfield, the people of Illinois, be directing our frustration, our anger, our concern, our abject fear about what is going to likely happen in this state if this doesn't change?
We reach out to our legislators, our lawmakers, and especially our key leaders that in Illinois really have the power to direct the budget. And I mentioned to you yesterday, I'm left with the question of where is the profile and courage? Where is the profile of a legislator or a key leader that even though it's unpopular, does what has to be done to help people that have to be helped? That's a profile and courage, and I'm looking for that person.